Hi there, my name is Gerard Green. It's really exciting on Saturday, the 20th of February, to start the early Saturday morning clinic with a visit from my really dear friend and esteemed colleague from Western Australia, Dr. Jo Milios. And Jo is with us this morning from a very sunny and hot Australia. I think she said it's 32 degrees, whereas here in the UK it's cold and raining. And Jo's here to just give us a brief overview of what she's going to do with us in March on her prostate rehab course. So Jo, a really big welcome to you.
Thank you so much, Gerard, and it's always wonderful to see your face again and to have the opportunity to work with you despite the distance and the COVID times. This is what we can now have an opportunity to offer one another. So thank you for supporting me, and thank you for the invitation to continue building on the education in men's health.
Yeah, it's really exciting, Jo, and the live online stuff has been brilliant because it's enabled us to have some brilliant people like yourself come and teach for us. And so what I'd like you to do is just give us an overview of what you plan to cover in those 2 mornings in the middle of March.
I think it's really important just to get a bit of a baseline and understanding that men's health physiotherapy has only been really acknowledged as a part of our profession since 2017, Gerard, when you and myself actually launched that at WCPT in South Africa. So we want to understand that we're starting really from the beginning for a lot of people. So this course is really an introduction to prostate cancer patient management, and it's to give those especially new to the field the chance to just touch base, finding out a few fundamentals. So my own PhD focus was on the rehabilitation and in fact prehabilitation of men undergoing radical prostatectomy or the surgical treatment of prostate cancer. So in that whole experience myself, I had to learn from day dot about the assessment techniques, and then the opportunity to work out on protocols for pelvic floor muscle training. So we're going to be covering the background of prostate cancer itself, and then treatments commonly used in prostate cancer, with a large focus on the rehabilitation on men undergoing prostate cancer surgery or radical prostatectomy. So we're going to be looking at how to assess the pelvic floor via external means, and we're going to include real-time ultrasound approaches. We're going to learn a little bit about the research that I started off with, trying to show a relationship between pelvic floor muscle function and continence outcomes. And then a big focus on the preparation for urinary incontinence and erectile dysfunction through exercise, with a big focus on pelvic floor muscle training. We're going to have the opportunity to learn about different functional position trainings that I found really helpful, which will all be backed up by the research I did produce. And then we're going to have the opportunity to continue a good sort of introduction overview of erectile dysfunction and how physiotherapists and allied health professionals can actually assist in the education of patients in that sexual function recovery. So that's pretty much it in a nutshell there, Gerard.
I think that was on one breath, Jo. That's obviously all your yoga training. And I suppose the other thing that people will be really interested in is that you'll be talking through how to use the vacuum pump.
Yes, so a lot of the principles around penile rehabilitation, they're physical strategies that we as physiotherapists have a good opportunity to educate patients from day dot. So vacuum pumps are just one part of penile rehabilitation. So we normally start off with medications, and then we use a stretching device, and that men apply, if not daily, every other day. So we can go through all the mechanisms behind that, and the whys and the hows, and the different types of models that are available.
And Jo, I think it's really good what you've said, that you're going to focus on a lot of the external assessment technique, because I think that's somewhat reassuring for people. So it means that this is an area of practice that, you know, musculoskeletal physios can get involved in, obviously women's health physios, but people maybe who don't have that specialist background pelvic health training, because as we both know, there are lots of men out there who find it really, really difficult to find help, who are having a really crap time.
Yeah, Gerard, and a lot of physiotherapists will have the opportunity to have that skill in internal assessments, but certainly in men's health, it's not actually necessary for men who are undergoing the radical prostatectomy. And that, you know, is something that was my foundation. And it was really because the real-time ultrasounds became available around that time. But whatever skills that we have, palpation, internal, external, we can all draw from that body of experience and enhance what we already know. It's often a reluctance to expose oneself, I guess, in the men's health field, especially for patients. So a lot of the techniques that I'll share with you are all about sort of breaking down those barriers and minimising the kind of embarrassment and displeasure that some of those more internal assessments actually incur.
And I think what a lot of people email me about is, you know, do I need to have an ultrasound machine to do this work? And I think we're quite fortunate here that we've got two, but it's just to reassure people that if you have an ultrasound machine, that's brilliant. But most clinics don't, and that if you don't have an ultrasound machine, you can still do this work and you can still assess these men and you can still treat these men, which you'll obviously also cover in the course. And Jo, I suppose I've got just a couple of final questions for you. Everyone, especially from the UK and Ireland, want to know, you know, things sound like they're really good in Australia COVID-wise.
Yeah.
And how has it affected your practice? Has it affected COVID?
Well, I live in Perth, Western Australia, and to be perfectly honest, we've never had community spread of COVID. We've only ever had some incoming cases in hotel quarantine. So we've never actually had a lockdown at all until 2 weeks ago here in Perth, when we had one case with the new South African strain, which is a bit more virulent. So we had to spend 5 days in lockdown. And to be perfectly honest, I think the immediate response from the Australian government was just to stop anyone coming in and stop anyone coming out. And that was from March the 2nd last year. So we just never actually let it come into our country. And those that have ordered in have just been travellers really, and then they've been in quarantine. So the only outbursts that we've really had are just any contamination in it between incoming returned citizens or those travelling as a matter of course, and then having a little bit of contact with quarantine workers.
And I think to highlight the difference, when Jo and I started chatting this morning, Jo said she was preparing to go to a Madonna-themed 80s birthday party tonight, whereas here in the UK, we're barely allowed to go out for a walk. So that's it's always inspiring for us to see that things have improved elsewhere, which is what we are looking forward to, hopefully in a couple of months' time. So Jo, a really big thank you for taking the time. Enjoy the sunshine, enjoy your evening out tonight, and we are all really excited about spending Saturday and Sunday morning with you on the 21st of March. And we really appreciate you taking the time to do that, because I know your time is very in demand, both with your work, your research, your patients, your charity, not to mention your family and friends. And I hear a dog barking in the background as well. So I presume that takes up a lot of time as well.
That's Apollo, my puppy. And then the neighbours were talking a little bit out the front. So, and I was trying to banish myself from the teenage space in my house. So sorry about all the extra noise.
No, not at all, not at all. It's good. It's real life. So Jo, really big thanks and enjoy your party, and we will see you in a couple of weeks' time.
Wonderful. Thank you so much. I look forward to catching up with you all. Feel free to ask many questions all the way through. So thanks.
Brilliant.